Well, good morning, everyone. Good afternoon. Wanted to briefly introduce myself and welcome everyone to this the summer series of our webinar on the Nigeria Integrated Public Health Emergency Operations Center in Edo State. It is a delight to have you all here. And we are grateful, as always, for USAID's support of this event and of the Data for Implementation project overall. I wanted to make a couple of housekeeping notes at the very beginning. All of you should have your mics muted as our panelists begin to present. And there will be an opportunity for questions later in this webinar. We are looking forward to a thoughtful discussion, and we welcome your contributions. When you do have a question, please use the raised hand icon to indicate that you are ready to ask your question, and we will try to get to you as soon as we can. Otherwise, this recording will be available later this week or next week on our YouTube channel. I will put the link in the chat, and we will make everyone aware who is part of this webinar registration list. Otherwise, we are ready to proceed with our wonderful panelists and moderator. I'd like to introduce Otse Ogori, our Data.FI Nigeria Country Director, and esteemed moderator who has had quite a hand in the production of this webinar today. So with that, and without further ado, I'd like to hand it over to Otse, and thanks for joining us.
Thank you very much, Jesse. This is really appreciated. Good morning, good afternoon, and probably good evening to everyone that is on this webinar today. It's a delight to have you join us this afternoon here from Nigeria, and we're excited about the ability to provide an insight into what we have been doing in Nigeria, working at the subnational level and engaging with stakeholders in country. I will not start this before I go forward. I want to say thank you to USAID for providing this support, and also to PEPFAR and the American people for making this possible. Also to say thank you to Edo State, who has been a very worthy partner and a very worthy support in engaging at the subnational level. Today, we'll be looking at an integrated approach to global health security, setting up Nigeria's first ever integrated public health emergency operations center. This has been the work Data.FI has done with the Edo State government, and we've been able to achieve this milestone. And we thought it would be helpful to have a webinar to share experiences and also for people to learn lessons of what we've done in this regard. Before I go forward, Data.FI is a global project. It's called Data for Implementation, a global project implemented in multiple countries, and it's funded by USAID, and is operational in over 20 countries. The goal of Data.FI is to harness the power of data and technology to improve health outcomes. As we go ahead in our presentation, you'll see how we've been able to harness the power of data and technology, and also engaging with stakeholders at that level to improve the health outcomes of the people of Edo State. So I'll quickly go ahead and share what we have for you today. We have our panelists, and I will be introducing our panelists, and then we'll go into the discussion. I'm yours truly, the moderator, and we have on this panel the acting office director of the HIV/AIDS and TB office in USAID Nigeria, Omoshalewa Oyelaran. She's here. Please give her a warm welcome. We have Dr. Stanley Ehiari-Wang, Permanent Secretary, Ministry of Health, Edo State. We also have Dr. Ojefo Stevenson, Director of Public Health, Ministry of Health, and Dr. Eyo Nora, the State Coordinator of the World Health Organization in Edo State. As you see, the mix of the panelists, it's a work of collaboration, and we'll hear that as we go forward. So how will this webinar, what's the agenda for this webinar? Like there's going to be an introduction like I've just done. We'll have a panel session. We'll have a remark from the Permanent Secretary of Edo State Ministry of Health. Then we'll have panel session, which is structured into 4 components. We'll have question and answers, and then we'll talk about the key takeaways. I just want to quickly say here that as we progress in our discussions, if you have questions, if you have comments, do well to put them in the chat box. Or if you want to speak, we'll just raise up your hand and we'll unmute you, and then you can speak through the mic. So without further ado, I will hand over to the Edo State Permanent Secretary for the Ministry of Health, Dr. Stanley, to give us his opening remarks. Over to you, Dr. Stanley.
All right. Good afternoon from here, good morning, good evening, depending on which part of the globe you're in. I've heard you talk, Ose, thank you very much, and even the first speaker, telling us how wonderful we've been. I think we should actually be the one to thank you very profusely for all that you're doing in terms of improving health outcomes in our country, Nigeria. And even where I'm seated here now, this is the Integrated Public Health Operations Center in Edo State that was commissioned on the 21st of May jointly by His Excellency and of course the Consul General of the United States Embassy. We are particularly glad because we've had a public health operations emergency center before now, but we are very happy because Edo State would be the first state in Nigeria to have one for integrated approach to ensure that all public health events in the state are coordinated from one center. And then I would like to say that as a state, we are doing our best to ensure that we work very well and very closely with our partners, appreciating all that they bring to the table, all the technical support, financial and otherwise, all that they've done to ensure that we have a very functional center. And so on behalf of the people and government of Edo State, we want to thank the people of the United States of America, represented by USAID, PEPFAR, and even other partners like the WHO and Data.FI. I hope that today will be a day worthwhile in terms of all that we'll be discussing today, and that moving forward, the reason why this EOC was set up would really become evident in the lives of our people. Who would want to see an improvement in the quality of life of our people, and of course, longevity. Once again, I want to thank you all for making this happen, and I wish you also very fruitful deliberations. Thank you.
Thank you very much, Dr. Stanley. Your remarks are well appreciated, and we're excited that you've been a worthy stakeholder and a worthy partner in working together to achieve this result. Like Dr. Stanley said, and I'm sure most people on this call must be well aware, in Nigeria, we've had challenges with having a coordinated response to epidemics because we have different emergency operation centers that respond to different disease entities. We have during the advent of COVID, we had COVID situation rooms, we had HIV situation rooms, we have polio EOC, we have immunization EOC, and there are all these EOCs scattered around the state, which led to duplicity, it led to wastages, it led to duplication of roles. Data.FI started working with the Edo State government, and under the leadership of the governor of Edo State, were able to set up a coordination hub that delivers real-time solution and updates on public health events. And this is the Edo State Integrated Public Health Emergency Operations Center. You can see on the picture to your right, I believe, it's when the the IPHEOC was commissioned by His Excellency, the Governor of Edo State, who did this alongside the Consul General of the U.S. Consulate from Lagos. It was a very memorable event, and as we speak, we'll see what is currently operational from this location. We have EBS, we have technical working group meetings happen there. HIV situation room has now been integrated into this situation room, and other activities as we hear from the panelists. So we'll move quickly into the panel session and then to discuss these questions. Again, like I said, if you have questions, please put them in the chat box or put your comments in the chat box. Or if you want to speak, raise your hand. We'll have a time for Q&A. Raise your hand and we'll unmute you and you can speak. So going quickly into the questions, we'll go first to the Director of Public Health in Edo State, Dr. Stevenson. I just want you to speak about the basic structures of the Integrated Public Health Emergency Operations Center in Edo State. How does it operate? Over to you, Dr. Stevenson.
Good afternoon, everyone. I'm very pleased to be here this afternoon. I want to thank my permanent secretary for joining me here. I appreciate Data.FI, WHO, and partners, the USAID. Right here at the Public Health Emergency Operations Center, like my permanent secretary said, we are right here, and we are taking this meeting at the conference hall in the Public Health Emergency Operations Center. The structure, from the beginning, Public Health Emergency Operations Center have been existent in Edo State, but we deem it fit to approach His Excellency the need why we must bring all the public health events under one single umbrella as a hub. And the first thing we discovered was that we need a space for such, and we have to approach His Excellency for a space, and was able to allocate where we are today to the Ministry of Health for use. Now, right here we have the Public Health Emergency Operations Center, which house the situation rooms for different disease entity. We have HIV situation room, Lassa fever situation room, measles, diphtheria situation room, TB situation room. We have the EBS, event-based surveillance system, right in here. We have Data.FI has a table and office in this place, because they have been our major partner with respect to data quality assessment and collation analysis in the state. We have other partners who join us in this space, working right here in the EOC, like the WHO and NCDC. We have in this situation room, in this EOC, the PHEOC manager, who has an office here, and the Director of Public Health, my humble self, who also serve as the General Incident Manager of the Public Health Emergency Operations Center. It's not left out. I have my office right in here. And we also have a side lab for sample collection and storage for dispersion. So the Integrated Public Health Emergency Operations Center, like the country director earlier said, in the country before now, even to date, in different states of the country, they have different EOCs scattered all over the place. If there's any measles outbreak, they set up another emergency operation center. If there's Lassa, if there's diphtheria, if there's COVID, that is how you set them up. But Edo State had deemed it fit to come together under one umbrella and set it up in the manner which house every disease entity or public health importance in one roof. And that is what we have been operating. And I must say that we are moving well, and we are more coordinated, we are more integrated, we are seeing through our data, and we are working hardly with them. Thank you.
Thank you very much, Dr. Stevenson. You actually mentioned something, that there are still states in Nigeria that still operate multiple emergency operation centers and also situation rooms. And I know there are a couple of states that are that have joined this webinar listening to you, and they might want to do something like this in their state. What lessons can you share? What can others leverage when setting up their own integrated public health emergency operations centers? What challenges should they expect, and how can they overcome these challenges? Over to you.
Thank you so much. Yes, in the recent meeting, the workshop organized in Lagos, the National is planning for Integrated Health Emergency Operations Center, which is a very welcome development. And that is the way to go, because integration is the key word this time. We have to integrate all our activities. For the first challenge that one may want to put at the back of his mind is the physical structure, space, accommodation, and the buy-in of the stakeholders. Because I must confess here that if my governor was not interested in the health indices, improving the health indices of Edo State, there's no way we can get this done. Even if I have the dream will just be in incubation and that will never be delivered. But fortunately enough, I have leaders, bosses that are very responsive, like my PS, my Honorable Commissioner for Health, and His Excellency the Governor of Edo State was very interested when I brought that to his table, that we need to house all public health events together as an integration. And the first challenge I presented was that if that must be possible, we need a structure, a space that can house the situation room, the event-based event-based surveillance system center, all the incident manager's office and all that need to be in one place. And we have to put up all our gadgets in one place where we can view real-time data of all public health diseases. And he has to provide us where we are. And going forward, having done that, he also supported in making sure that the place is set up timely, and with the assistance of Data.FI and other organizations, we were able to get the place set, and it was inaugurated in May 21st, 2024. So the challenge that we may first of all encounter if we want to set up such in any state, which we must put at the back of our mind, is the buy-in of stakeholders. The stakeholder must be interested. The governor of the state must be interested. The commissioner must be interested. And other stakeholders, the people that drive the health indices in the state must be interested. And having been interested, they should be ready. They should be ready to understand the concept of an integration. They should be able to understand that integration reduce wastage of fund, reduce wastage of manpower, encourage cohesion, and drive, have to drive health data to produce a better outcome. So if they can be convinced in this pattern, I believe every stakeholder will get a buy-in. So when the stakeholder buy in, then there must be commitment from the stakeholder. When I mean commitment, the stakeholder, the government has to show a commitment. In this case, the government have to provide the structure, because Data.FI could have may be ready to support Edo State. But assuming we don't have the structure, there was no way Data.FI is going to support us without the structure. So the government commitment is very key. Then partner support will make it perfect. And that is what I should expect from every stakeholder going forward. Thank you.
Thank you very much, Dr. Stevenson. You stressed a couple of things. You stressed the physical structure, you stressed political will, stakeholder buy-in, state government support, and also the commitment of the government. I just want to pick up on stakeholders buy-in. I know apart from Data.FI USAID supported project, one of the key stakeholders in the state that have supported this initiative is WHO. So I want to go to Dr. Ayonora. I want you to give us your perspective in working with the state government to support this initiative. What are the lessons that you want to share, your perspective in working with the state to actualize this? Over to you, Dr. Nora.
Thank you very much. Good afternoon, good evening, everyone. First and foremost, I would like to start by appreciating the leadership of the state under His Excellency, Mr. Godwin Obaseki, the Executive Governor of Edo State, for his giant stride in the health sector and for creating enabling environment for partners in the state to conduct their activities. Edo State is very good in welcoming good initiatives, such as the Integrated Public Health Emergency Operation Center approach. World Health Organization and other partners provide technical support to the Integrated Public Health EOC. And as stakeholders supporting the state, we believe the Integrated Public Health EOC approach is the way to go, as it provides an avenue for the various stakeholders to come together, review the health issues in the state, come up with a mitigation plan, and monitor the implementation of the plan to strengthen the healthcare system for the benefit of the state. An added advantage is that the Integrated Public Health EOC harnesses the power of digital systems to improve public health programs. Thank you.
Thank you so much, Dr. Nora. One key thing that you mentioned is you said that stakeholders come together, they monitor the implementation of the plan within the space, and they work together to actualize this plan. So I want to return back to the Director of Public Health, Dr. Stevenson. How has the IPHEOC enhanced decision-making in responding to public health events in Edo State?
Thank you so much. I must commend the WHO state coordinator. They are our strong partner. You know, before now, we are analyzing we are approaching our interventions of various public health disease entity in different fold. This time, we have been able to set up situation rooms with the help of the Data.FI, strong cooperation and collaboration from WHO. We're able to set up a very strong situation room. Yeah, there are other partners that work with us in the state, but I must single out WHO and Data.FI when it comes to integration of this Public Health Emergency Operation Center, because they have really played a vital role. Yeah, we go to field and work, but we cannot know the extent we have gone if you cannot come together in a place and really analyze what you have achieved. And that is what we have achieved in this Public Health Emergency Operation Center. Here, we can view our real-time data. The HIV data can be viewed right here, real-time data. We can view our measles data, vaccination. We can monitor the trend of our vaccination in different local governments, in different ward and communities. We can know, pinpoint and map outbreak situations in some communities like diphtheria outbreak and all the rest. Most importantly is the Lassa endemicity in the state. For years, we have been battling with Lassa, but I must tell you that with the upgrade of the IPHEOC to this state of integration, we are able to harness many other stakeholders together to view the real-time data. What we are planning at this point, which all stakeholders are coming together, is we want to be coming out with publications from this integration Public Health Emergency Operation Center. And I have promised my team that before the end of this year, we must roll out publication of a reputable journal from the Integrated Public Health Emergency Operation Center. Edo State may be the first state that will do that again. That will also go into record. This is boiling out from what we have done together by bringing up together stakeholders who can now view the data. And I told them that we are not just here to view data. We must work with data. We must come out with policies. We must show to the world what we have been able to achieve. And the only way you can show to the world what you have been able to is to make sure the data before you. And that is what we are up to. I must say that the stakeholders are working around the clock. Imagine we hold our meetings. Our IPHEOC meeting is twice weekly, Monday and Friday. And at that instance, we view different data from different disease entities, ranging from HIV, TB, Lassa, immunization data, diphtheria, monkeypox, and all of that. And at that meeting, all important stakeholders, drawn from Data.FI, drawn from WHO, drawn from other partners in the state, Heartland Alliance, Red Aid, and other stakeholders, even security agency are always in our meetings. And we draw people from different health MDAs, the Hospital Management Agency are there, the Edo State Primary Academic Agency are there, the Edo State Health Insurance are at the EOC. That is how strong the integration can be. But when we were not yet integrated, we are just working in silos. But today, we are no longer working in silos. We are very articulate, we are comprehensive, we have our real-time data being viewed and being criticized and being harnessed. We filter the data and we prepare them to form a good health policies that will guide and improve the health indices of the state. And that's where we are.
Thank you very much, Dr. Stevenson. I think this is really, really enlightening. You said something about harnessing data and using data, and you spoke about the plans, the vision that you have for the IPHEOC to come out with publications. But we want to know, you started touching on the next question I wanted to ask. How does the IPHEOC help you to leverage digital solutions to improve your coordination and emergency response?
Yes, thank you so much. In the era of COVID, the National Center for Disease Control rolled out SOMAS, which is a digital platform for data collation. And that was in force when COVID was invoked. But that was the only thing that we were used to in Edo State. Data.FI joined hands with us, and we are using SOMAS to upgrade our services in Edo State. But as we roll on, the DHIS2 was also incorporated, which is also from National. That is also in use in Edo State. Those are platforms, some of the platforms we use in our data. Then the Data.FI was able to help us to, key us into the AAR. And we are able to create a dashboard for immunization, be able to create dashboard for HIV, be able to create a dashboard for diphtheria and different disease entity. So in that perspective, we're able to use this digital dashboard, which are displayed in our Public Health Emergency Operations Center. When you see the day of inauguration, when I was giving my briefing to His Excellency, you could see me demonstrating with the dashboard display at the Public Health Emergency Operations Center here, situation room. And they are real-time data. We know how many persons have been tested for Lassa fever in Edo State today, as I speak with you. And we can pull them out from our dashboard here and analyze. We know how many are positive and how many mortality we have recorded from the beginning of this year outbreak to date. Same with diphtheria, same with measles, same with all other disease entity. HIV, we know the number of HIV positive patients in Edo State. Going further, we're able to bring together TB and HIV. Now we know how many HIV positive patients in Edo State that are coexisting with TB infection. And we know how many HIV infected patients in Edo State that are not coexisting with TB tuberculosis infection. And this is how we are able to come together to straighten our data dashboard and filtering our data, synchronizing our data, filtering our data, and to make sure that the data we have a well-filtered and organized data that can be presented to anybody anywhere in the world. Again, we have been able to organize our data platform, and to the extent that we do data harmonization. We have a treatment center, which is Ira Specialty Teaching Hospital, that help us to collect data. But in most cases, we call them for a meeting, a hybrid meeting, a DOC meeting. We invite them for a hybrid meeting where we want them to, we tell them, look, we want to harmonize our data. Let's know what is in you and what you have there and what we have here. And we have discovered that in most cases, there are some data that are recorded against Edo State that are not really cases for Edo State. Assuming we don't have an integrated public health emergency operations center, I must tell you that such the state that the way to go this time is a digital data system. And the only way to actualize or achieve this digital data system is to integrate all public health events together. And again, I have to commend the effort of the National Federal Ministry of Health that is coming up with integrated health emergency operations center. This time they are going to be bringing in other medical emergencies like ambulance emergencies and other medical emergencies into incorporate them into the public health emergency operations center. Now, those state is a step ahead. We're just going to be building on that. That's why I said we still have some other areas to address. We're going to build on that and make sure that we incorporate all together for a better health outcome. Thank you so much.
Thank you so much, Dr. Stevenson. It's what you just mentioned shows a lot of coordination and how you have leveraged data systems from different disease areas. And this has helped you to reduce duplication of efforts. It has helped you to reduce wastages. It has helped you to reach entities, areas where you might adventure maybe in the past had challenges reaching. It has also shown synergy. You've created synergy and also efficiencies in resource utilization. You spoke about Lassa fever and how you are utilizing this space to address issues with Lassa fever in your state. I just want to go to USAID now. I want to direct this question to Shalewa. In your view, how does the operationalization of the IPHEOC in Edo State contribute to global health security implementation? Over to you.
Appreciate, as has been mentioned, the investments and the buy-in, as was mentioned by the DRPH, of the governor of the state, as well as the Ministry of Health, the State Ministry of Health. It really is essential if we are going to be able to address global health security on a broader scale, that we really look at that response starting not only at the national level, but really we look at buy-in from the subnational level. We are not able to do a global response to COVID, for example, only at the federal level. And Nigeria is an excellent example through these integrated emergency operational centers of how to really engage and integrate at the subnational level. So our ability and globally, the ability to continue to address global health security across all diseases really is important, as it enables us to look at some key components. So ensuring that we have the right information, that we are communicating effectively, and that we're educating the public at large about where we're going. So I think as we look at the investments in Edo State, this really is about, as you previously mentioned, DRPH, it's about how do we continue to move you towards a center for excellence. And if we can get every state, every subnational level to move towards centers of excellence for public health response and preparedness, and through the utilization of EOCs, this can be really an exceptional way to ensure that these EOCs helping us to centralize coordination and really decision making. As we are aware, as donors and donor community, we really are focused on utilizing data for decision making and ensuring that we have centralized and integrated data is really the way forward to addressing and being able to stay on top of disease surveillance and monitoring. Really, that means that we're looking at case-based surveillance on a regular and timely basis to ensure really that collectively as a state and consequently, as a country, we are moving forward and looking at how diseases are affecting our population at large. As we know, diseases are not isolated, and sometimes, as we, for example, if we look at TB and HIV, they're coordinated with each other and affect each other. So it's really important that we are looking at that real-time case-based surveillance at the national and international level to report up to the international level in terms of where each country is now moving towards that preparedness and response. So I think this utilizing the EOCs as a standard practice as we move forward is really going to be essential to that global health, security, framework, as if I should put it, to ensuring that we are collectively identifying synergies across the board that will help us to align with international guidelines, and to also ensure that now that we have the right data and information, that we are moving to a way in which we're communicating how we're responding accordingly and identifying those best practices. That means that we're effectively communicating not only with providers across different sectors, but also communicating and educating the public at large about how to be prepared and ensuring that information is done correctly. So when we have EOCs that are working in an integrated manner, they're able to take, for example, global messages or federal government of Nigeria messages and tailor them for their country context and their disease-specific context to ensure that the public is effectively informed. And that's really important as we build the holistic capacity of everyone, from the public individuals themselves to our providers at large, to respond effectively to disease. And again, I think it's important to recognize that, as has already been mentioned both by Otse and Director of Public Health, that we are adequately ensuring that we're leveraging resources across multiple areas. For example, I was glad to hear you mention the engagement of the state insurance scheme and the state insurance body as you're looking at how you're preparing to respond to these various disease outbreaks. So it is important that as we look at preparedness with respect to how we're using data to ensure preparedness, it's also ensuring that we are collaborating together. But at the end of the day, it really is about early detection and prevention and preparedness. And so anytime that we're actively ahead of what's happening in the public health at large is a win for the state and for the people of Edo State. And looking broadly as we sort of scale these sort of integrated emergency operational centers across Nigeria as a country, looking at the public health and monitoring that public health at the national level is equally important to global health security. Nigeria is one of the most populous countries on the continent. And so as we often say here, if we don't win in Nigeria, we won't win in Africa. So really, I think want to commend the Edo State government for their success and being one of the first to roll out the EOC, and really I'm grateful to be a partner with you all in these achievements. But collectively, you know, this is really broader as we continue to see Nigeria in terms of a global health, so identifying global health partnerships. And so I think being able to bring in additional investments, being able to be a partner in the emergency operations center and operation care. But I think at the end of the day, what is also important in global health security is the ability to make continuous improvements. And so I think the more and more that the integrated operations center comes together and the more lessons that you have, the better off we will be able to influence how effectively we should be responding to global health security concerns. In Nigeria, as we all know, it's not just a health issue. So we have climate change issues, we have natural events issues that come to the table, and having this centralized coordinated effort really is commendable to the global health security. So I'll stop there, but again, much appreciation, and this is the initiating sort of how we continue to move forward to protect and detect the public health at large.
Thank you so much, Shalewa. You gave so much scholarly responses, and I'm particularly excited that this is being recorded. So we'll definitely go back to these responses and make use of these responses in the future. Thank you very much. You touched on a lot of things, and you talked about, you touched on case-based surveillance, communicating effectively, passing out the right information. You spoke about One Health, which is really, really key going forward. I will still come back to you in terms of the resource mobilization part, which you spoke about a little. But before I come back to you, I just want to ask a quick question to the Director of Public Health. How is the data? So you spoke a lot about data. How is the data in this IPHEOC used to better mobilize and allocate resources for better health outcomes in Edo State?
Thank you so much. And that is, I'm happy you were here when the PHEOC was being inaugurated, commissioned by His Excellency, along with the United States Consul General, Lagos. You could see the governor's passion when it comes to data, because he wants to see the trend of your data so that he knows how to address any disease entity. And that was why he was very, very passionate in making sure that the Public Health Emergency Operations Center come to life. You were also here when he was saying that the next step is to link the PHEOC to the Edo Communication Center, where him as an individual can be viewing the data of all disease entity in his own convenient abode. And those are the indices he wants to see. Now, you could see that when I was making my comment before now, I said we have integration of all health MDAs into our Public Health Emergency Operations Center. The health insurance is very key, because health financing is key in any health intervention. So the health insurance has been dragged into the PHEOC to see how we can leverage on the insurance scheme services in addressing some health issues in Edo State. Let me take Lassa fever, for example. We discovered in our last year outbreak that majority of mortality recorded in the states were due to late presentation at the treatment center, which is Area Specialty Teaching Hospital. Going forward, we have to dive deep to know why is it that we are having patient late presentation at the treatment center. And it was tied to lack of financing. Patients were afraid to go to the hospital because they believe when they get there, they will not have money to pay for cab, they will not have money to take care of themselves. With that evidence, we were able to approach His Excellency, who now gave a mandate to the health insurance that any Lassa positive patient at Area Specialty Teaching Hospital should be automatically be enrolled into the health insurance, and the bill be taken care of. That was one. Again, there was also a caveat that any indigent patient who comes down with Lassa fever and is not able to take care of the bill, the state takes care of that bill. With this on ground, no patient was now unwilling to present him or herself at the treatment center. And that is what data can do. And we are seeing, if assuming we are not having all those things black and white in our data, and trying to do comparison with the aid of graphs and see how the trend of our cases, and we're able to track that the mortality recorded were due to late presentation. That was able to be achieved by following the data, synchronizing them, and we're able to present it to His Excellency. And this year we have seen that trend coming down. So the mortality are lower compared to last year, and we no longer have late presentation of patients to the treatment center. And that is what data can do. So health financing is very important, and how the data have helped us is we are able to drag resources to address that component. Again, we are able to leverage on different other resources, like from NCDC. This is the only year that we have carried out. Lassa fever endemicity have been in Edo State for over 2 decades, over 20 years. But this is the only year that we have carried out an outbreak investigation of Lassa fever. That was when the Excellency said Lassa fever must be eradicated. If not the data that he's seeing, he will not give us a marching order to that we should see how we can eradicate Lassa fever from Edo State. And we believe that for us to eradicate Lassa fever, we have to dive deep to know the root cause. Irrespective, we know that the causative host, which is the Masomi Nanthalensis rat, we also have to know whether is it only the rat that is the risk factor associated with the spread of this virus. So we have to dive deep to carry out that outbreak investigation. Like I earlier said, we are working on it. Data.FI state representative Kester is aware. We want to come up with a publication from that our outbreak investigation. We are seriously working with IPHEOC Specialty Hospital, the incident manager from IPHEOC Specialty Hospital, and other stakeholders at the IPHEOC to see how we can come up with a publication on that. We discovered that one of other risk factors associated with the spread of the virus is lack of potable water, and that we are working on. The state government, with that, they have been able to map all the communities that are lacking potable water, and they have mandated the Ministry of Water Resources to go seek boreholes in some of those communities, so that in the next year, going forward, we will see whether, with the provision of potable water, whether the Lassa fever cases will come down in that community. So that is the way we are going. And I believe that with this trend we are taking, with this step we are taking, in a short while, we're going to overcome the menace of Lassa fever in Edo State. And thank you so much.
Thank you so much, Dr. Stevenson. One key thing that I really appreciate from the lessons you are sharing with us is that you are not only integrating. Yeah, can you hear me?
Are you hearing me? Audible?
Yeah, I can hear you. Yes, we heard you loud and clear. So I was just saying that one key thing that you did in Edo State is you were able to also look at integration at the state level. So you're integrating the health MDAs, health insurance, and you're also utilizing domestic resources like the NCDC resources, which is really, really key. It shows that you're maximizing domestic funding opportunities for the enhancement of this EOC and using data as a tool to mobilize these resources. I want to go quickly to Shalewa. Looking at how Edo State has looked inward to mobilize resources with the data that has been generated from this IPHEOC, do you think that how can this success, let me rephrase it this way, how can this success enjoyed in Edo State help to spur funding initiatives similar to what we have seen in Edo State from the donor perspective? I know Dr. Stevenson has talked about how he has looked inwards and been able to get funding from within the state. How can initiatives of this nature help to as a catalyst for funding or for similar initiatives in Nigeria? Over to you.
Thanks, Otse. I think that really what Edo State is the first step. I think as donors, as we begin to have conversations around excuse me, around sustainability and this environment of being able to have return on our investment, it really is also being able to see the state level contributions through domestic resource mobilization. So first and foremost, for states who have not been able to look internal to leverage their resources or look at economies of scale between around health financing, that's one of the first things that I think as a demonstration of proof of concept that we want to see states or country teams being able to do. As we are aware, often there's some level of counterpart donor funding, counterpart country or state funding. And so the ability to demonstrate that is excellent. So I think the conversation that is already ongoing in Edo State around health insurance is really another key indicator that we're looking at to see, you know, how our health services integrated into your health insurance scheme, how you part, and we understand that there are limitations in funds, but we also want to see the integration of diseases in the health insurance scheme, for example. So, and then I think as was mentioned by the state, to really see how you're leveraging those resources to cover the needs in your state. So now looking beyond the state and trying to build sort of donor confidence in your ability to get additional funds, it's really again, looking at that return on your investment. We want to see high cost effectiveness. We want to see improved health outcomes within the states. We want to see enhanced monitoring of those outcomes and of the ability for the state to pivot accordingly to the response at hand. So for example, if we look at, if Edo was the state that had low enrollment in care for those who have TB, for example, or specifically, let me highlight for those who have MDR. We know that in this disease category, nutritional support serves as a challenge for those that need to be in treatment for MDR. And so being able to do an investment case and provide an investment case that, hey, we're utilizing our funds to monitor our response, but we have a gap in this area, and here's the data to demonstrate the root cause, as has been articulated by the Director of Public Health, and this is why we need a key investment in this specific area. The ability for a state to identify specifically their areas of need and have data to help us be able to respond to those needs and invest to ensuring that health outcomes are increasing is really, really important to getting that donor investment. Really, I want to commend the use of data, the language around data, not just data collection. I think it's the one thing for a state to just collect the data, but the evidence through this conversation in Edo State is really that they are utilizing that data for decision making. And in the environment that we are with limited resources, that is really important. Again, I think the other thing that has been mentioned is the ability to get stakeholder buy-in. And right now, Edo State is leading the charge here with the level of investments from the governor and all the way down and across disease-specific categories and across other sectors is truly commendable for them. So I think collectively being able to show that internal utilization of data, that domestic resource mobilization, and the ability to demonstrate a key specific areas of investments and partnerships. I think one other thing to mention that we haven't talked about a little bit here is that private-public partnership. So the ability to look at your state and also leverage that private sector engagement in your response can also be fruitful as we look at how donors can continue to invest in states. But overall, yes, I think it's really important that we look at how to not just have isolated funding, but how do we leverage upon multiple options for funding to really move the public health outcomes forward within the state.
Thank you so much, Shaliwa. So leveraging multiple options for funding is actually one of the key things that you just mentioned. And thank you very much for all those points that you've listed. Time check, we are about 7 minutes to the end of this. So I just want to say, if you have questions, please put it in the chat box. If you have comments, you're also welcome to put it on the chat box. If you want to raise your hand, please indicate and someone will unmute you and we can tell you when to ask questions. So just to quickly round up, DPH, I know this is, our time is fast spent. If you can just give us some tips about, you spoke about aligning the Edo State IPHEOC with the National Integrated Health Emergency Operation Plans. Can you just give us a few tips about what you think the state intends to do to align itself with the Federal Ministry of Health agenda on the Integrated Health Emergency Operation Plans? Over to you. Dr. Stevenson, please. I don't know if you heard me. We seem to have, can anybody hear me?
Yes,
I can hear you.
Oh, I think maybe we've lost Dr. Stevenson. While he's getting back online, we'll just go to Dr. Nora. Maybe maybe the final question I would pose to you is, what are your experiences or the lessons you want to share that other stakeholders that are supporting state governments or supporting subnational entities can take home to help actualize this kind of result?
So let me start by saying that it is very key to work with the state leadership to get their buy-in. This will ensure sustainability and continuity of the integrated public health EOC. We enjoy strong collaboration in Edo State among partners supporting the state and the state leadership. Indeed, working together pays better than working in silos. And that is what the integrated public health EOC is all about, bringing everyone together to form one formidable team for health.
Thank you so much, Dr. Ayonora. This is really appreciated. DPH, can you hear us now? Dr. Stevenson, can you hear us? All right. We'll go to the questions and answers. Do we have questions in the chat box? Jesse, over to you if you have questions.
Because my network. Can you hear me?
Yes, we can hear you now. So because of the
So
time,
I don't know
we'll just.
my network. Yeah.
Yes. Can you hear us now?
Yeah, I can hear you now.
So because of time, we're just going to questions and answers to hear what people have to say concerning what they have heard today. Jesse, over to you if we have questions or people that are willing to raise their hands to speak. Over to you, Jesse.
Okay.
Thank you, Otse. We did have a question from Ernesto Herrera, and this one was included in our chat. Ernesto wanted to know which platform the IPHEOC system, health information systems are using, whether they're DHIS2, ARCGIS, and does the Emergency Operations Center have a One Health approach?
Thank you so much. Yes, we are using SOMAS. We are using DHIS2, which is under One Health approach. We are using DHIS2, SOMAS. We are using a Data.FI platform for HIV interventions. We are using digital microplan for digital microplan dashboard for routine immunization, and data analysis. We're using also USAID Data.FI platform for DSNO surveillance DSNO's surveillance dashboard, that is surveillance data dashboard. So those are the platform we are really using in harnessing our digital data system in Edo State. The DHIS2 is linked to the national data dashboard for data harmonization.
Thank you very much, Dr. Stevenson. Just to make a note here that the Data.FI tools that he talks about, these are interoperable with the DHIS2.
So I don't know if I was audible.
Yeah, you were audible.
Network is breaking.
Yeah, you were audible. So they are interoperable with the DHIS2 platform. And we also have a tool that we built on the DHIS2 platform that is currently being used by the state to visualize their data. So yeah, so these are DHIS2 platforms that is currently being used. Over to you, Jesse, for the next question.
Does anyone else have a question? And we can try to unmute you. If you can raise your hand, I can get you to get on camera and ask your question. Okay. Let's see. Jan Boehm, I think has a question. Jan or Jan?
Thank you so much, Jan. Yeah, that's fine. Hi, my name is Jan Böhme. I'm the managing director of the SOMAS Foundation. As you just mentioned that you're using SOMAS, it's not much of a question. It's more like if you need support in everything regarding SOMAS or making it compatible with Data.FI, for example, then please just contact us and we are there to help. That's all I wanted to say. Thank you.
Thank you, Jan, for offering. Thank you.
We have another question from Mary Aiken. what was the team's experience with the integration of IPHEOC into existing interventions to support timely response?
Dr. Jeffo, Jesse, can you read the question again?
Certainly, yes. Mary Aiken asks, what was the team's experience with the integration of the Public Health Emergency Operations Center into existing interventions to support timely response?
Dr. Jeffrey, if you can hear us, you could respond to it, or anybody within the states can also respond to this if Dr. Jeffers.
Can you hear me now?
Yes, we can hear you now.
Can you hear me now?
Yes. Please go ahead. Please go ahead if you can hear us.
Okay, but I didn't get any question. It's like my network was fluctuating. Is there any question on the floor?
Yes. So the question has been typed into the chat, but it comes from Mary Aiken.
Hello.
And it looks like we're having some connectivity issues, but the question has been included into the chat. And Mary Aiken says, what was the team's experience with the IPHEOC into existing interventions to support timely response? I hope that was clear.
If we're unable to hear the DPH, maybe Kester can respond. Kester has worked very closely at that level. He can provide some context to that. Yes, we can hear you if you can hear us.
All right. Thank you so much, sir. Thank you so much, Mary. I think so far so good. Please, can you confirm you can hear me?
Yes, we can. Please go ahead.
Okay. All right. Thank you. So, so far so good. We have enjoyed a very timely response to activity right now. Currently, within the IPHEOC, we are able to get the team, the rapid response team across the 18 local government report timely through the system that we have, and we can actually make prompt decisions through our data review meetings, and then be able to provide feedback to the teams on ground so that they're able to carry out their activities smoothly without any hindrance. Thank you so much. I don't know if that answers your question.
Thank you so much, Kester. Jesse, over to you. Time check. We are just 2 minutes above the hour mark.
Yeah, we have one question from Suleiman Abdul Fattah. This one is on data. How do you ensure data reliability and validity, especially from remote settings, if you're maintaining a real-time dashboard?
Dr. Stevenson.
Okay. Okay, if I may. So if you were on the call earlier, you will hear when the DPH was speaking about hybrid meetings, especially from treatment facility, to actually compare what we are seeing within at the central level and also what they have at their level. And that was why we were able to discover some cases that were not actually for our state, that actually reported for our state. So we try as much as possible to carry out a lot of data quality, especially when we are visualizing, so that whatever decision we are making it based on actual data that is actually for Edo State and not for other state. I don't know if this answers your question, please.
Thank you very much, Kester. I want to say that we are still open, and the team is open to receiving more questions from people on the chat on the webinar, and we're open to answering your question. You can reach out to us. This will be posted on our YouTube page, and Jesse will provide the link to that YouTube page. You can ask your question on that platform, and we'll respond. We'll do well to respond to your questions. So I'll just give 30 seconds each to all the panelists to just give us your closing statements in terms of how the IPHEOC will help or has helped in reducing Nigeria's national infectious disease burden, and how it will help prepare for emergency threats and global health security concerns. So just 30 seconds to give us your closing statement. We'll start with Shalewa.
Sure. Thanks, Jose, and thanks for the opportunity to join this conversation. But I think at large, I think what I would say is that it's subnational preparedness. That is the way to go, and having core lines of communication to report up to national status. I think as the previous question mentioned, data quality assurance and data quality is equally important. And so that's why the need for continuous conversations around the data and utilization of the data is important. But ensuring really that engagement, that data use, and that flow of information from the subnational all the way to the national, that's really how I see that we're going to continue to be able to find success and to continue to monitor disease and surveillance management across the states. Thanks.
Thank you very much. Dr. Ayo? Dr. Eleonora, your closing statements.
Okay, thank you very much. I want to say that working together in the state as a team has really helped us to address multiple health issues together. And we really want to continue to work as a team to improve the health indices in the state. Thank you.
Thank you very much. And to Dr. Stevenson, if you can hear us, your closing statement. It looks like we're still having challenges with Dr. Stevenson's network. But I want to just, if we're unable to get him, I just want to use this opportunity to say thank you to USAID for supporting this project and for supporting this initiative. And thanks to the American people, it's been great being an implementing partner under the USAID. Under USAID. And it's also want to say thank you to Edo State for providing the platform for us to be able to collaborate and for being a very willing stakeholder and a willing partner to advance the cause of the work that we do in country. Thanks to WHO, Dr. Nora, for being here. And thanks to everyone that has connected to this webinar. Thank you to the Data.FI colleagues that have worked behind the scene. I'm here to lead this webinar, but we have a lot of people that have worked behind the scenes to ensure that this happened. So thank you very much. And of course, thank you to the Edo State Governor, His Excellency Dr. Governor Obaseki, for his tremendous support to ensure that this happened. It's been really, really great. And I will not close this meeting without saying thank you again to USAID, our activity manager, Chika Obiorokafo, and also to Bayo Nimode, who is our fund manager. If you look into this picture, you see Bayo I'm sitting next to Bayo. So thank you very much for all your support and for guidance and for the leadership in ensuring that this is actualized. I think we will close here, and thank you very much, everyone, and have a good rest of the day. Bye-bye.